My name is Shelley. I had planned this summer to get a full knee replacement and went in and got the knee replacement. And after that, everything just went downhill from there. I wasn't able to even eat or stand up or anything. My husband finally took me to the hospital where they found that I have COVID and pneumonia and all that kind of stuff, or pneumonia. And found myself here at Bryan with all these people that are just really being extremely helpful. I initially had made the choice not to get immunized because my choices were, it's become so highly politicized that it's very difficult to follow all the white noise, because to me, I'm sorry, I just don't feel the politicians have the right answers. They don't have the right education or training. And you get them, and then you get the news media, or not the news media, excuse me, I'm sorry, the movie stars and all that, and putting their input. None of them know what they're speaking of. We need to talk more, get rid of all the white noise with the political comments and all that kind of stuff. We need to get rid of all of that. And we need to get the professionals out there who really know and work every day with this and have their stories and know what's working, what's not working. But let's get rid of white noise, because I think that's what's stopping a lot of people from it, because you don't even know who to listen to.
Great. I think that's a great segue here to Dr. Maslanka. Dr. Maslanka, can you just kind of give an overview of Shelley's case, and then and talk about the vaccine, the efficacy, the data that you have seen, and kind of where things stand in Bryan in terms of COVID, as well as maybe just across the state, what you've seen.
Okay. Well, first off, I just want to say a big thanks to Shelley for being brave enough to share her story. It's an incredible, timely, important message right now. We're hoping that it reaches individuals and prevents someone from possibly being in her shoes, hospitalized or worse. And so thank you very much for this. She was in Syracuse, Nebraska, and had her knee replacement done. No clear known sick contacts or anyone that she was around that was high risk or a clear inciting contact prior to her symptoms of shortness of breath. And so she went into her local ER there. She was very hypoxic with low oxygen levels, requiring significant amounts of supplemental oxygen. And it was at that point that they decided to transfer to Bryan for a higher level of care and close monitoring. And over the next 2 to 3 days, things progressed very quickly, and she was actually in an intensive care unit level of care, requiring just about the highest level of supplementation that we can give prior to mechanical ventilation on a ventilator. Thankfully, things turned around. Some folks are not that fortunate, but she is, and has, over the last few days, made great progress and is getting close to the point where we can get her off of oxygen at baseline with rest. But when she exerts herself, there is little reserve, and she needs significant amounts of oxygen, even now, to just get out of bed and use the restroom. And so it's been a difficult time, but we're happy to see that she's turned the corner, and we'll continue to do things probably as an outpatient in the next few days. I think her message is very important because in hindsight now, I'm sure looking back, and if you could talk to yourself prior, what would you say?
I would get it. I would. Again, the white noise is just overwhelming. You don't know who to listen to and all that, but now knowing what I do, I would get the shot. It's, you know, it's been around for over a year now. And I realize that there are some issues where you might have problems, might not. I don't know. Again, is that white noise or what? But it would have helped me.
And I think that you are not alone. There are many people that come into the hospital. This pandemic has become a preventable pandemic at this point. And it makes it that much more disheartening with this most recent wave because it's almost universally full of unvaccinated patients. And with the Delta strain being a much more easily spread, and especially with a higher viral load, which puts the potential for fast decompensation or increase in serious complications in patients of all ages, and some with no past medical history that would put them in a high-risk category that we would think of before. It should be scary for the unvaccinated population right now. And especially as restrictions have been reduced, because thankfully more than half of people have been vaccinated, so things have been a little bit lax from that point. It makes that transmission that much more fast, and the potential for a surge that much more real. And so this is something that we want to get out in a very succinct and clear message. Get the vaccine. Get it as soon as you can. It is available. It is free. And we hope that you can please listen to Shelley, listen to your healthcare providers, and join us in this fight. Together, we can close this long, terrible chapter and hopefully get back to a time where we can live a good life again. But
great. Well, thank you, Doc. Oh, sorry. I was just going to say. Yeah.
Sorry. I think what she said is listening to your personal physician, your healthcare professionals is important and key, and trying to limit the background white noise from those that shouldn't really be giving advice on things like this, because it is dangerous. And,
great.
we're hoping that message can be reached to individuals so that we can prevent things like this from happening.
Well, thank you both very much for those opening comments. Very insightful, and absolutely, we certainly encourage everybody to get the vaccine and prevent hospitalization and serious injury. So I want to open it up to the media now. We have, let's see, looks like about 7 or 8 media guests. I think the best thing would be is if you have a question, just go ahead, please unmute yourself, ask the question, and then remute yourself so that there's no bleed over in the video on speaker view. So media, if you have questions, feel free to unmute yourself and go ahead and ask those questions.
Hey, Shelley, if you don't mind, would you be willing to share your last name with us?
Yes, it's Wachter.
I'm sorry, could you spell that as well?
Wachter.
And Shelley, when were you admitted into the hospital? Do you remember what day that was?
Well, I had my knee surgery on the 13th, and then the first admission would have been on last Friday.
Would you be willing to talk about again? I know the doctor kind of already asked that question, but just, what was that? When did you realize, was it when you were laying in your hospital bed realizing, hey, I should have gotten the shot? Or, what was that, telling tale of when you knew that you should have gotten it?
Probably the minute I got the diagnosis. Probably the minute that they said I had COVID. it was pretty terrifying because I was there in Syracuse when they ran the test and they got it. My husband stepped out of the room just for a couple minutes to go get a fresh pop, and they wouldn't let him back in. And from that moment on, I have been completely alone going through this, with the exception of these wonderful people. And I thank God for them. But yeah, it was probably that moment thinking I could have saved myself and my family so much by having gotten the immunization.
Are you from Syracuse or are you from Lincoln?
I'm from Syracuse.
Sorry, I'll ask another question. Once you're, back to a sense of normalcy and out of the hospital, do you plan obviously on getting your shot? And if so, which one do you think you're going to go with?
Well, I guess I will discuss that for sure with my primary care physician, but I do plan on getting it. They were discussing that probably about 3 months is the time period I will need to wait. But as soon as that grace period or whatever you want to call it is up and it's time, I will be getting it.
Any other questions from any other media members on the line?
Hi, Shelley. This is Matt Olberding with the Journal Star in Lincoln. Would you mind telling us how old you are?
I am 59.
And Dr. Maslanka, maybe you could just talk about, is her case kind of typical of what you're seeing lately with people? How their disease is progressing, how seriously ill they're getting?
Yes. This surge has been different from others in a few categories. One is the vast majority, above 97% unvaccinated. And the ones that are vaccinated are either octogenarians or in that later generation and older age, or have had chemotherapy or on medications that make their immune system less of a able to respond and mount that protective response that the vaccine gives. So this is a population that is preventable most and across all ages, so much younger on average. And the course of their condition progresses much faster, from coming in, needing a couple liters of oxygen to in 24 hours, it's called heated high flow oxygen, and then BiPAP, and then at risk for needing to be ventilated on a ventilator.
And then, Shelley, one more question for you. Did you, before you had your knee surgery, did you have to have a COVID test for that?
I don't recall that I did. I don't think I did.
Okay.
I did that up in Omaha, so I don't even know for sure.
Shelley, do you have any idea when you'll be leaving the hospital? Do you have a little bit longer stay or have any idea?
I really don't know for sure. I think we're kind of just doing it one day at a time. It sounds like maybe a couple of more days with grace of God. But
Each day at a time. But when she exerts herself even minimally, she's requiring significant oxygen. So we have to make sure that comes down, but her trajectory is improving as well.
Shelley, do you have people around you, family members, friends that you know are going to go get vaccinated now because of what you've gone through?
Well, quite honestly, my husband had gotten vaccinated before me and he was trying to convince me to do it a while back. And so he's already done. We have 5 children between the 2 of us, excuse me. And some of them have made that choice to do it. Some of them at this point have not. I'm working pretty hard on the have-nots.
You know, you said, sharing your story, you're hoping that your story will, kind of break down those walls of people not wanting to get the vaccine. Can you kind of talk about, in your own words, your hopes of sharing your story, what that will do?
I'm hoping that it will get people to start listening to the right people. I would like for the politicians to bow out and let the right people talk. Let them, they've got this wealth of knowledge that we can use that is just, they're anxious to share it with us and have us use it. But you've got all these other people that are interjecting themselves and they really have no clue what they're talking about. Even you've got on the TV, you've got the TV personalities that are up there making a statement and it's all politicized. I want the politics gone from it. This is a real health issue. It's not a political thing.
Okay. Any other questions from any other media members on the line? Thank you, Shelley, and thank you, Dr. Maslanka. Just to kind of, while we have everybody here as well, and to piggyback off what Dr. Maslanka said, how it's affecting younger people, older people. I'll be sending out some information later about a story that we're doing tomorrow with a local high school athlete. She's under 18 years old, and she's dealing with some severe effects of the COVID long haul syndrome. And she has got her first vaccination about a month ago. Unfortunately, she tore her ACL in competition, so she's had to wait a little bit to get her second vaccine, but she's doing that soon. So another reminder as school starts and as Husker football games get to going and sports, how important it is and how this is affecting older, younger, everybody. And it is a health issue. And yeah, just my 2 cents on that. So, okay, one last final call for questions. Okay. Well, Shelley, thank you very, very much. Dr. Maslanka, thank you very much as well. We appreciate you taking the time to share this message, and we hope it resonates with people out there who are maybe on the fence and maybe thinking about it, and hopefully they get off the sideline and they go in and do it.
I agree.
Okay. All right. I'm going to end the meeting now. So I thank everybody. If any follow-up questions, just please email me and we'll go from there. So thank you.